Hello everyone. In this part of presentation, we will discuss about why to quit tobacco and what are the methods of quitting tobacco. For getting answer of the question why to quit tobacco, we must know about the immediate and long-term health benefits of quitting tobacco. If anybody quits from tobacco, so within 20 minutes, the heart rate and the blood pressure drops. Within 12 hours, the carbon monoxide level in the blood also drops. Between 2 to 12 weeks, the circulation in the body improves and lung function also increases. At 1 to 9 months of quitting tobacco, the symptoms like coughing and shortness of breath also decreases. After 1 year of quitting, the risk of coronary heart disease gets half that of the smoker. After 5 years, the risk of stroke also reduced, and that is risk as equal of that of non-smoker. After 10 years, the risk of lung cancer falls to about half of a smoker, as well as the risk of cancer of the mouth, throat, esophagus, cervix, and pancreatic cancer also decreases. Now let's discuss in those people who have already developed some tobacco related health problems and now they are quitting from tobacco. If anybody quits tobacco at 30 years of age, then he gains almost 10 years of life expectancy as compared to those who are already continuing the use of tobacco. At the age of 40 years, there is gain of 9 years of life expectancy. At about 50 years, gain is of 6 years. At 60 years of age, there is 3 years of gain of life expectancy. If there is already onset of life-threatening diseases in the person and if he quits, so it has been seen that there will be a rapid benefit in those persons if they quit. And if any person who is already had a heart attack in past, if he quits from tobacco, so the risk of getting heart attack again will be reduced by 50%. Now let's discuss what are the barriers of tobacco prevention. The first barrier is the lack of knowledge about the harmful effects of tobacco and its products among the persons in the community. The second is the nicotine dependence. If anybody is using tobacco for a long term, he has already developed the nicotine dependence. There is lack of motivation in the person to quit tobacco, lack of advice and support from the community. If there are lack of trained healthcare professionals who are not having any kind of training about the tobacco cessation and tobacco prevention therapy. If the health professionals are already using tobacco from their own, and so in this condition it will be very difficult to provide the other persons about the quitting tobacco activities. If there are lack of interest in smoking intervention in the community as well as in the individual level. Now let's discuss about some tips to abstain from the smoking. There are many harmless nicotine substitute available in the market, so this can be used as a nicotine replacement therapy. Persons should avoid going to the triggering areas like bars. If anybody is having craving for the tobacco, so the person can choose sugarless gum or candy which are easily available in the market. Person said should move towards the smoking free zone if he feels craving for the tobacco. Daily exercise has been seen a very beneficial method for quitting tobacco. And apart from that, there are some alternative relaxation techniques which can be utilized like deep breathing, muscle relaxation, yoga, exercise, and music therapy, so that person can go away from the tobacco cravings. Now let's discuss about the cessation support to the person. These are the various methods of tobacco cessation support. The first one is the behavioral management. The second one is the psychological support. The third one is pharmacotherapy, and the last one is nicotine replacement therapy. The first method is behavioral management method, and we can say it is a guide to counseling, and this method includes various steps. Those are ask, advise, assess, assist, and arrange. The first step in the behavioral management is ask. So if anybody comes to us, so in that condition, firstly we should ask about his status of tobacco addiction or tobacco consumption, whether he is still consuming the tobacco, means he is a current tobacco user, or he has already quitted from the tobacco use, means he is a former tobacco consumer. Apart from that, we should also see some oral signs of tobacco use. Those are stand teeth, halitosis, means bad breathing coming from the mouth, any periodontal disease, or any presence of any discolored patches over the gums and the mucosa. These patches can be of white color, red color, or any other dark color. In this step, we can also use the Fager-Stomp test to know his cigarette addiction level, and by asking some questions, we can assess his addiction level. If these scores are more than 8 plus, means there is high dependence for the cigarette smoking. If it is between 5 to 7, there is moderate dependence for the cigarette smoking. And depending upon this Fager-Stomp test score, the person can be given either a nicotine replacement therapy, or he can be given a combination therapy. The second step in the behavioral management therapy is advice, and our advice to such tobacco addictor should be very clear. For example, my best advice is for you to quit smoking. Our advice must be very strong, like, as your healthcare provider, I need you to know that quitting smoking is the most important thing you can do to protect your health. Our advice must be personalized. Impact of smoking on the baby, the family, and the patient well-being. The third step in behavioral management is assess. So in this step, we need to assess the person to quit tobacco in 30 days. If he does not want to try to quit from the tobacco, in this condition, again we need to increase his motivation level. If the person has strong motivation to quit tobacco within the 30 days, in this condition, we will proceed in the next step and we will assist those persons. In this step of assist, we will help the persons by providing them problem solving methods, as well as by increasing their encouragement level. We should also provide him some social support if they want to quit tobacco, and we will also provide them some tobacco cessation materials in the form of, it can be in the form of pamphlets, posters, where the methods of quitting from tobacco are already given. The another step in behavioral management is the arrange. So after that, we need to arrange for the follow-up of such persons, we should ask them about their concerns and their difficulties while during this method. We should also organize for their talk in front of others so that they can share their success stories to other persons. Apart from the behavioral management of cessation support, the second method of cessation support is by psychological therapy, and this psychological therapy can be provided by a psychological counselor or it can be provided by a psychiatrist. The another method of cessation support is pharmacotherapy, by using some medications or some other products examples are nicotine replacement therapy, the medication which mimic the effect of nicotine. There are some medicines which are antagonist, the medications that make the aversive. These medicines which were aversive medications are drugs which produces some unpleasant effects like nausea or a combination of some other undesirable behavior. Now discussing to the nicotine replacement therapy. So this therapy is used to reduce the cravings among the persons, but they don't have any kind of subjective effects on the such persons who are using them, and this nicotine replacement therapy also suppresses symptoms of nicotine withdrawal. These are the various forms of nicotine replacement therapy presently being used. We can use chewing gums, sublingual tablets, lozenges, adhesive transdermal patches, nasal sprays, and nicotine inhaler cartridges as a nicotine replacement therapy. These are some picturesque depiction of such nicotine replacement therapies: chewing gums, sublingual tablets, the lozenges, transdermal patches, nasal sprays, the oral inhalers. This is the list of some medications which are being used as a pharmacotherapy for cessation support. The first category is medication which mimic the nicotine effect. Those are bupropion, hydrochloride, clonidine, anxiolytics, antidepressants, etc. The second category is antagonists like mecamylamine, naltrexone. The third category is the medications which make intake aversive. Those are silver acetate combined with the sulfides in tobacco. Thanks for watching this video. If you have liked this video, please share with others.